everybody. I work in a family practice office, so I'm your primary care provider. And I'm just going to review some things that help me out as your provider and also help you out to get the most out of your appointment. Bring with you, if you have a symptom journal, if you have a medication list and a past medical history, as well as a blood pressure record. So when you have a complaint and something's going on with you, it helps for you to keep a journal so that I have a very clear picture as to what your symptoms are, when they come on, how long they last, what you're doing when they start. All that stuff is really important information for me to be able to formulate a diagnosis for you. I often cannot prescribe medication or treat you unless I know what you're currently on. So it's really important that your primary care provider and really anybody that's taking care of you knows exactly what medications you take on a daily basis. Your past medical history is important to me. I need to know exactly what's going on with you, what serious illnesses you've had in the past, any prior hospitalizations that you've had are very important to helping me formulate a diagnosis and to help treat you appropriately. So a blood pressure record is very helpful for me. I have a lot of patients come in wanting to go over their blood pressure. If you want to review your blood pressure, it's really helpful for you to already have this record with you, and then we can go over it together and adjust your medication accordingly. Another thing that you can do is make sure that the paperwork is in the office. So before your office appointment, you want to give the call to the receptionist and make sure that they have something that you want to go over. So if you've seen any recent specialists, I know a lot of my patients go see specialists, and then before they follow the specialist's advice, they want to come back and talk to me about what I think and what path they should take. I'd like to have the note from the specialist so I can see where their thought process is. Also, if you've had any radiology reports or labs done recently that you want to go over, especially if I did not order them, it helps if you call the office the morning before and make sure that those are on your record. Sometimes what happens is you come in, you tell me that you want to go over these records, and I end up not having them, and I have to, have you wait while I wait for the records to come over. The other thing I wanted to touch on is a discharge summary. When you are admitted to the hospital and the hospital sends you home, they send you home with patient information. So while that's very helpful for you, it's not very helpful for us. Your provider needs a discharge summary. When you go to the hospital, when you're discharged, the physician that took care of you summarizes your entire stay while you were there with all of your labs, all of your radiology reports, and all of their thought process behind what they diagnosed you with and why they did that. So I just want everybody to understand that there's a difference between the paperwork that you are discharged with from the hospital and the discharge summary that's written by the physician that was taking care of you while you were there. And it's important that we, your provider, have a copy of your discharge summary. So there's a few things that you can do to get the most out of your appointment. The first thing that you should do is list your issues in order of priority. You want to make sure that you cover the thing that's most important to you while you were there. And in the event that we should run out of time, at least we covered the most important thing. The other thing is you can consider bringing a family member with you. I know that right now during COVID-19, we are not having a lot of family members in the office. Pretty much we're limiting it to, unless you need help getting into the office itself with your family member, the family member has to wait in the car. What I do is I have to make sure that the person that's coming into the office, if they want their family member to be present, can put them on FaceTime or put them on speakerphone so that they have an input to what your symptoms are, what your complaints are. I can't tell you how many times I have a wife come in with her husband, and the husband has a different story than the wife has. I really do like to get all of the information because it really helps me come up with what I think is going on with you. I actually print out a care plan, and I think this is really helpful. I let you know everything that I want you to do when you leave my office, and it's really important. I want you to follow the plan of care that I've laid out for you, so I want to make sure that you have all of that information before you leave the office. And sometimes there's a lot of things that happen during your visit, and you forget that everything that we went over, you think you have a good idea, and then you leave and you don't. So don't be afraid to ask your physician that you're seeing or your provider that you want a printout of the care plan. And if they don't have that service for you, you can also take notes. Have them write it down on a piece of paper or whatever it is, just so that you have it for a new patient. again, like, you call ahead to make sure all the paperwork is there. You want to call ahead the day before your appointment or the morning of your appointment, and make sure they have all of your records. We like to get your records from your previous physician that was taking care of you, a recent discharge summary. All of that stuff is important to us. We want you to bring with you the medication list, any history, if you've had any immunizations. So it's helpful if we know if you've had your pneumonia shot or your shingles shot. That's stuff that we need to know, so we know if we are going to recommend it for you. If you happen to be a young person and you're getting ready to graduate from your pediatrician and seeing your grown-up doctor, it's important that you check with not only your physician, but also your parent or your guardian, and make sure that you know if you've had any allergies, if you've had any surgeries in the past, if you have had any hospitalizations, illnesses, and it's really important that you have your childhood immunization record. I have a lot of adult patients that come in and they've been my patient for several years, and all of a sudden they're going back to college and they need their immunization record. I don't have that unless you've provided it for me in the past. So what's really helpful is before you leave your pediatrician to get your immunization record and have it on you. Keep it in a safe or keep it at home in a safe place just so that you have it.
Hello, everyone. It's a pleasure to be here. I think that my portion of the talk is going to be pretty relevant, and I will be talking more about it from an orthopedic perspective, but I think this can be applied to any type of specialty service that you go to see, whether it's orthopedics or any cardiologist, anything that's outside of your primary care physician. I think one of the most important things, and it's something that people don't dwell on as much, is to have the appropriate insurance information and identification when you come in. A lot of times, you see a specialist, or in my case, orthopedic surgery, or patients will be referred, and then they come into the office and find out that we don't take their insurance. Where if you're looking at time and trying to maximize your base time or your evaluation by the doctor, you want to make sure that you have that with you. A lot of times our office will send demographics and intake forms to your house. We'll email that to the patients, or we will send it by mail. And this saves time when you come to the office, so that as soon as you get in, you're not spending the extra 15, 20 minutes to fill out the paperwork. Or sometimes we have what we call freezer pads. And that's sort of electronic demographic taker that will sort of confirm everything that we've had before. So a lot of times filling out that paperwork beforehand will make that portion of the visit a lot shorter. As Marita discussed before, your list of medications is important. It's a hard topic for a lot of patients, and a lot of patients don't understand why they're on certain medications. And when they come in, you ask them and they'll say, well, that's just what my doctor put me on. And a lot of times in orthopedic surgery or any other surgical profession, things like anticoagulants, people on aspirin, Coumadin, Plavix, those things become very important, and some patients don't even realize that that's what they're on. I think another important thing is your list of your current doctors, because if you're being indicated for a surgical procedure, knowing who your cardiologist is, who your rheumatologist, your primary care physician, even your pain management doctor, those things become very important, because in the post-operative setting, those are the people that we're going to look to help manage, whether it's your pain post-operatively or making sure that you're back on the appropriate medications that you might have discontinued prior to the procedure. I think another important thing, any imaging beforehand. So this includes x-rays, MRIs, and things that can help me to formulate a proper diagnosis and treatment on that initial visit. A lot of times having to come back and forth for 2 or 3 visits because you don't have everything with you, that become time consuming. And it's also, it takes away from us being able to get you scheduled or taken care of in a timely fashion. Another portion is at the end of your visit. Once you've seen the doctor, you've gotten your x-rays, he's done his physical exam. I think from an orthopedic perspective, for me, I try to make sure that people understand the diagnosis. A lot of times the patients come in, and if it's a gentleman, he comes in with the wife. And why is the wife there? She's pretty much there just to make sure that he heard everything that I said to him and that he understands exactly what's going on. So having that additional person there is helpful. And I understand, we talked about this before with COVID and everything. There are alternate ways to make sure that the information gets out there so that you don't leave the office and not understand. The doctor told me that I have pain in my shoulder, I have tendonitis. I'm not sure what exactly that means or what I'm supposed to do about it. So it's really important to understand the diagnosis. After that, it's the role of advanced imaging. So are we going to send you for a CAT scan? Or are we going to send you for an MRI? Do we need something additional? And why do you need that advanced imaging? Is it going to give me more information? Is it going to help me to plan for your surgical procedure or for any other specialist like a pulmonologist sending somebody for pulmonary function testing or anything like that? Those are the things that you want to understand why you're being going for and the importance of it. I think the most important, one of the other things that I tend to stress a lot before the patient walks out is what their treatment options are. So if we start talking about non-operative and operative interventions, when it's non-operative, I tell them, we can look at things on two across the spectrum. We can start with the most minimally invasive things and the most invasive things. And then I give them those options and I tell them where they stand and where they're going, why I'm giving them those options and why we're going down that route. So I make sure that that's understood before they leave the office. So if it's non-operative, anti-inflammatories, physical therapy, or some other treatment modality to help them out, I think it's very important that they understand why they're going that and why we're doing that. A lot of times if a doctor's telling you you need surgery for something, you distance yourself because you're just thinking, oh my goodness, I have to have surgery now. And you forget about all the little details that are most important to understanding why you're having it done, what needs to be done, what's your recovery time. Are you going to be out of work for 6 weeks or are you going to be out of work for 6 months? The family members at home, are they going to need somebody there in the house? Are they going to be in a sling for 6 to 8 weeks? And how much is this going to affect their activities of daily living? The success rate of the procedure, every doctor should be able to give you, it doesn't matter what field it is, he can tell you what the success rate, especially because everything is evidence-based medicine at this point. So I think that's also an important aspect of it. The risk and complications. Nothing is without complications, nothing is without risk, even if the benefits outweigh them. You still want to understand that. And other things is timing and what exactly you need to do. So when can you have it done and who do you need to see? You need to see a cardiologist, your primary care doctor, your pain management. You need to get pre-surgical testing, labs run. So all those important things I think all those things are really important to understand because some people lose sight of that. They lose track of who they need to see, when they need to see it. They forget what medications they need to stop before the procedure, which ones to resume after the procedure. So I think a lot of those are really important, and not just in my profession, but I think across the board. Thank you.
When patients come in and they're in psychological distress, or they may have what I call a cognitive impairment, meaning that they may have some sort of issue going on that causes them to not think clearly, it becomes a challenge because I need to provide a diagnosis and a safe treatment plan for them. So there are some things that we can do, some questions that I'd like to go through with you. Um, and it seems very basic, but very important. So what are your symptoms? How are you feeling? I think for mental health, many times people have difficulty coming up with these symptoms, but just spending a few minutes reflecting on it, like Marita said, a symptom journal is one excellent way to document those symptoms. And for mental health, many times we do live with distress. We deal with regular life stresses. But did something change recently that caused these symptoms to get worse? This gives me a hint as to if you're experiencing a biological change or an environmental or situational change, and that can impact your treatment plan, right? If it's a biological change, do we need to look more down the medication route? Or if it's situational or environmental change, are there other types of treatments like therapies I can provide to you that can help you manage the situation? For psychiatry, mental health, we want to know what medications you're on. We want to know what medical medications you're on. We want to know what medications you're on for your mental health. And another important piece is any supplements. Are you taking any supplements? Are you taking any vitamins? Anything? We don't typically consider these things as medications, but just to give you an example, if you're taking supplement like St. John's wort and you come to me for depression and I prescribe a medication like Prozac, that can have a medication interaction. So it's really important that you just tell me everything that you're on and then I can make recommendations based on that. What psychiatric medications have you been on in the past? This is a really important question. You want to keep a record of this. Why? In psychiatry, every medication does not work for every patient. So in addition to that, we want to consider side effects. So what medications have you been on in the past allows me to weigh benefits and risk to make treatment recommendations to you. What is your medical history? Many times, a medical diagnosis can mimic a psychiatric presentation. I had a patient come in to see me one day, and I was doing his blood pressure, it's just a part of my mental health visit. And one of my subspecialties is substance use disorders. And I was looking at my patient and I said, "Have you been using?" And he said, "No." And I said, "When was the last time you used?" And so, why am I bringing this example up? He was sweating, he was pale, his heart rate was elevated, his blood pressure was elevated. He had no substance use and he did not have any recent substance use. I will tell you, even though he was coming to me for a psychiatric visit, he ended up in the hospital. I sent him to the emergency room and he had a thyroid issue that needed to be addressed. Symptoms such as fatigue, there's symptoms that we consider general symptoms or constitutional symptoms. And again, this can kind of go across the board, medical, psychiatric. So giving me all of those pieces, the psychiatric and medical, helps me figure out what's going on. Your primary care doctor is really important. We need to collaborate with your primary care provider, understand what's going on, and have that open conversation with them. In addition, support systems are vital for medical visits. But for psychiatry, I want to take this a step further and build on what they've said and say, do you have a safe person? Who is that person that you feel really comfortable with? I know sometimes with mental health, there's stigma issues and it can be complicated. So do you have that safe person that you can either have me collaborate with or I can contact? Do you have that person that you can bring in with you? That's even better. I know due to COVID, as it was stated before, we do have some restrictions on that, but if you can at least bring their contact information in, I can give them a call, we can put them on the speaker and we can collaborate on those issues. Hospitalizations for mental health reasons. So in the beginning of my conversation, I said when we were talking about mental health, we would take that primary care perspective, that ongoing well-being. But sometimes with mental health, we do have acute flare-ups or when symptoms get worse. And sometimes patients need to be hospitalized for these reasons. This is an important conversation to have with me. I want to know if you've been hospitalized. I want to know why you've been hospitalized. What were the situations, the reasons around that? And your family history. Family history is another important perspective that you need to capture if you can, whether it's medical and psychiatric, because again, making that diagnosis, all of these questions really come into play. They help me understand you and how you feel and your conditions in a holistic, comprehensive manner. And this will enable me to give you that diagnosis. Many times I have patients come in and they tell me what their diagnosis is, but they don't really understand what it means. If you don't understand, it really is important that you do ask those questions. We really want those questions from you.